Association, or MPHA. My co-panelists and I today are going to encourage you to think beyond the healthcare system as you tackle health equity, because health does not begin or end at the doctor's office. Healthcare can't create good health if multiple people can't get to the doctor because they lack transportation, or can't store their meds because they lack housing, or can't manage disease because they lack access to nutritious food. Health is created in the social and structural conditions within which people live, and that is why zip codes are such a strong predictor of health outcomes. I'd like to speak specifically to Section 36 of the bill, which would create health equity zones. Health equity zones are a public health strategy to invest in health at the neighborhood level, creating the conditions for people to be healthy. Zones are identified based on health outcome data, and health equity zones put communities experiencing health inequities in the driver's seat, directing dollars towards interventions tailored to the needs of each community. More than just a moral obligation, following the lead of communities results in better health outcomes. This evidence-based strategy has seen success in other places, and I will include more on that in my written testimony. Achieving health equity will take resources, but the cost of doing nothing is non-zero. Health inequities drive healthcare costs. We cannot contain healthcare spending without addressing the drivers of health inequities, which means investing upstream in the social determinants of health. Upstream investments that help people prevent illness outside of the doctor's office are less expensive every time. We urge you to move this bill forward as part of a comprehensive package that addresses health inequity at the scale required. And Senator Freeman, as you noted, there is a lot of bureaucracy in this bill, and bureaucracy is expensive. But just as you say that this will require everyone to come to the table, we believe that there is a role for every state agency to play in achieving health inequity. And so I think the goals of creating the State Office of Equity is to create that cross-sector collaboration within state agencies to make sure that every agency is also thinking about health and health policy and its role in creating health equity.
Honorable chairs and esteemed members, thank you for this opportunity to speak to you today. My name is Harold Cox. I'm a professor at Boston University School of Public Health, and I'm also a member of the Massachusetts Public Health Council. I live in Dorchester, and we are very proud to say that Dorchester is the most racially diverse part of Boston. However, we don't talk about the fact that Dorchester is also a tale of two worlds. On the one hand, there are people that pay more than $1 million for a condominium. On the other hand, there are people that need 3 jobs in order to keep a roof over their heads. On the one hand, there are people that can stroll very leisurely through the upscale markets that are popping up in Dorchester. And at the same time, there are countless numbers of people that depend on the food banks in order to feed their families throughout the month. On the one hand, there are people that have great health outcomes, but on the other hand, Dorchester has some of the highest rates of asthma and diabetes in the state. Dorchester is a tale of two worlds, and the contrast is stark and it's unforgiving. And because of this, I am a supporter, a staunch supporter of the bill, an act to advance health equity. Today, I ask you also to support the bill as well. Let me point out just a couple of things. First, the legislation will create an executive office of equity that collaborates across various government agencies. This collaboration is central and important to have a coordinated population health approach to address all the factors that influence our health. Secondly, this legislation recognizes the need to include women and individuals of diverse racial and ethnic backgrounds in key state government positions. Doing this ensures that policies and decisions that reflect the diverse perspective of our Commonwealth are represented. Lastly, when one of our world-class health organizations like Mass General or Cambridge Health Alliance wants to expand their services, they will need to conduct a health equity assessment. This assessment is important to help identify potential disparities and will lead to more equitable health care delivery. In conclusion, this legislation in its entirety 30 represents a comprehensive approach to advancing health equity in Massachusetts. It is essential that we do something to address the two worlds of Dorchester, the two worlds of Boston, the two worlds of Massachusetts. Please support this legislation.
Good afternoon, Chair Freeman, Chair Long, members of the committee, and the health advocates who have joined us today. My name is Dr. Bisola Ojikutu. I am the Commissioner of Public Health for the City of Boston and the Executive Director of Boston Public Health Commission. I'm also a practicing infectious disease physician. This afternoon, you've heard from diverse leaders from across our state who are experts in health equity. We have joined together at this moment in time in a way that we never have before, as the Health Equity Compact. Because we recognize that advancing health equity requires collective action and systems change. Though relative to the rest of the country, we have enormous resources in our state, we still have persistent and pervasive inequities in health outcomes. You've already heard about the life expectancy difference between a census tract in Roxbury and the census tract in Back Bay. What you haven't heard is that those data were produced by the Boston Public Health Commission, and it was a heavy lift. Sharing, standardizing, analyzing those data, it shouldn't have been that difficult. We need systems and policies in place that make that easier to do, because that's data that we all should have available to us. And as a testament to that fact, we actually haven't had that level of life expectancy data since 2012. You also haven't heard that infant mortality is more than 3 times higher amongst Black babies in Boston compared to white. Those data have not changed in the last 5 years. Similar stark disparities have been noted in diabetes, cardiovascular disease, and cancer mortality. These disparities are not new, and they're certainly not isolated to Boston, as you've heard. We're lucky in Boston to have a mayor, Mayor Michelle, who is supportive of our health equity initiatives. Health inequity is an urgent crisis across our state. One of the lessons learned over the course of the last 3 years is that disproportionate existence of chronic diseases at baseline will significantly exacerbate the impact that any infectious disease pandemic like COVID-19 will have on communities of color. I can assure you, as an infectious disease physician, that COVID-19 is not the last threat that we will face. It is not a question of if, it is a question of when. If we want to avoid significant morbidity and mortality in the future, if we want to avoid what we saw in terms of disparities, we need to advance health equity now. In order to do so, we need to do things differently. Establishing health equity zones, as you've heard, is a critical public health strategy that will allow residents to develop innovative solutions to the problems that they experience firsthand. Standardizing data, as I've already shared, it allows us to clearly target interventions and measure progress over time. And diversifying the pool of public health and health professionals is just common sense. It increases quality of services and access to care in our most underserved areas. These and other provisions outlined in the proposed bill will begin to finally address the root causes of persistent inequities in Massachusetts. We cannot continue to pursue health equity strategies in a piecemeal fashion as we have, institution by institution. We need solutions that are comprehensive and encompass the entire state, even if they need increased bureaucracy. Massachusetts has led this nation in reforming health policy. Now it's time to lead in advancing health equity. I look forward to working with you on this transformative legislation.